Welcome, my name is Becki and this is flexibility training designed for lower back pain, disc herniations and bulging discs. One of the most common reasons I come across for prolonged injury or lack of recovery is actually fear of movement. When we experience pain, we then become scared of moving in fear of experiencing more pain. Fresh blood flow heals, and fresh blood flow is created by movement. And so when we restrict movement, we restrict fresh blood flow and reduce the chance of healing. One of the most important things for our recovery is movement. We want to find a way that we can move safely and in as little pain as possible. We keep an eye out for what we feel is a red flag pain and move in a way that feels manageable for us. Today in this level 1 class, we will go through flexibility exercises that have reduced flexion and extension. And these are the two movements that are often most irritating for people with back pain and disc herniations. We'll look at lengthening the back line of the body as well as the front line of the body. When our posture is out of line, it can put pressure in the lumbar. And so we want to look at lengthening the areas that have become tight and strengthening the areas that have become weak. You can combine this class with any of the core strengthening classes we have for lower back pain and disc herniations as well. We'll start off with warming up the neck. Bring the chin towards the chest, lengthen the splenius capitis muscles. Bring the shoulders away from the ears. Notice the tension release. Take the head from side to side. Increase the stretch in the sternocleidomastoid muscles. Bring the chin down towards the shoulder and around, half circle. If you do not have neck injuries, you might wish to come into a full head circle, but only if it feels okay for you. Change direction. Come to centre. We'll warm up the shoulders. Come into some shoulder circles. Bring the shoulders up towards the ears and around. Maybe even massage the thighs and the buttocks with the fingertips. Stimulate the blood flow. Take the shoulders backwards, push the chest through the arms. In our modern daily lives, a lot of us have become to get a kyphotic posture where the shoulders round forwards through lots of sitting, typing, texting, driving. So it's important to open up the shoulders and the chest. If it feels okay and you do not have a shoulder injury, we'll come into an arm circle. Bring the shoulder all the way up towards the ear and around. Pretend that the arm is in between 2 panes of glass and aim to keep it in one plane. So reduce the arm coming out to the side too much. Take it backwards. If you've got a mirror can be super helpful. Sometimes we think our bodies are in a particular position, and when we observe them, we realise that it's actually quite different. Change sides. If you've got a teacher with you, that's fabulous. But if you're at home and you're watching a video, it's really helpful to have a mirror nearby. Change direction on the second arm. And the shoulder joint is an area where we can lose range of movement as we get older. So the best way to maintain the range of movement is to go through it as often as possible. All right, we'll come into a bit of rotation. Rotation for some people with back pain can irritate. If this is the case for you, keep the movements small and reduce the repetitions. Bring the hands together, keep the hips facing forwards. Turn from side to side. If it feels okay, bring the knuckles towards one another. Take a deeper twist. We'll twist all the way through the spiral line from the heels to the eye gaze. The further you take the eyes round, the deeper your twist. Go at a speed and a distance that feels okay for you. You might notice the spine begins to feel more lubricated. And come to center. We'll come into an arm stretch to open the shoulder up. Now it's a little bit warmer. Bring the elbow to the wall, the shoulder and the elbow in line. Take a step forwards and rotate towards the center of the room. As you push the elbow into the wall, open the chest. This beautiful stretch into the front of the shoulder. Maybe you even feel it all the way across the chest. And we'll hold here for around 30 seconds. This is when we begin to work into plasticity. Plasticity is where we lengthen the muscles beyond what is now their natural maximum flexibility range. We'll switch sides. Place the other elbow onto the wall, push into the wall, rotate, open the chest. You might notice in time that the stretch releases, or you notice you can take it a little bit deeper. Switch sides. And we do this for 2 to 3 repetitions. So we tend to warm up the body using some glide movement, some dynamic movement, maybe some bouncing to develop elasticity. Elasticity is the body's ability to bounce back. It's really important for the development of flexibility as well as the prevention of injury. It is something that we tend to lose as we get older, but it is something that we can retrain with movements like bouncing. Switch sides. We'll warm up with bouncing movements or glide in between. Moving between one movement and another to create separation between the muscles and the fascia. And then we move on to longer holds. which here it helps to lengthen the muscles, just like silly putty. We create heat, switch sides last time. When we create heat in the muscles, it helps them to lengthen. Just like silly putty, if we pull silly putty when it's cold, it snaps. Whereas when we pull it when it's warm, it relaxes and lengthens. Breathe into the chest, feel everything expand. Really yummy stretch on the shoulder. My shoulders are quite mobile, even for myself. I find this a really yummy stretch. Last side. You can do this at any time. A few shoulder circles to warm up the shoulder. Come into a nice chest opener. Great during the day for a desk break as well. We always want to hold for 30 seconds to 1 minute. And it's over the point of 30 seconds where the muscle will begin to relax and lengthen. We'll come into a nice chest opener, bring the hands to the wall and allow the chest to come in between the arms down towards the ground. Keep the spine nice and long, so there's no need to flex the spine here. You can keep the spine nice and long. Take some little bounces towards the wall. My shoulders are particularly mobile, so if you're not looking like this at the moment, do not worry. My shoulders are actually hypermobile, so it's an area of my body that is more mobile than the average person. So we never look at creating a shape or trying to look like somebody else's body. We're just trying to achieve a stretch or a strengthening. So as long as we feel a strengthening or a stretch, that's perfect for where we're at. Every body is different. Come up to center. Just allow everything to relax and release. And we'll hold. Bring the hands to the wall. Relax. I can bring my head to the wall. You might be able to do the same. You might not. Again, it doesn't matter. Breathe into the belly. Breathe into the shoulder space. Come up to center. Again, allow everything to relax. And we look at holding stretches for 30 seconds to 1 minute. We repeat 2 to 3 times. For achieving flexibility, this is a far more efficient way to go about it than, say, holding for 1 to 2 or 3 minutes at a time. We're better off coming out of it and then going back into it. Second round, long hold.
This is the sound of love's marching band. How they hold you like a gun, and how I sing you like
notice how the second or third round might feel easier as you relax into it. Maybe you can get that little bit deeper when you are coming into the stretch. If it's super easy, pull the ribs in a little bit more. Come up to centre, give the arms a little shake out. We'll stretch the calves now. Take a lunge, bring the right foot back and the left foot forwards. Push the right heel down into the ground. Just check the foot straight. Often the foot will come out to the side and then we don't get quite as much of a stretch into the calf and the Achilles. Bounce the front knee. And if the heel doesn't go down to the ground, that's okay, just as long as you send the energy of the heel down to the ground. Again, my Achilles and my calves are fairly mobile, just because I've done this a lot. So do not worry, wherever you are at is exactly where you're supposed to be, and as long as you feel the stretch, that is all we're looking for. Come to centre, and then lean forward and hold. Push the heel down into the ground. Squeeze the kneecap to lift the quad in front of the thigh. Lean in as much as feels okay for you. Switch sides. Start off with the little bounces. You might notice how one side already feels quite different to the other. We're not symmetrical, so we're generally tighter on one side perhaps than the other. Just through activities of daily living, through life. Maybe some of us have even had an injury at some point in our life, and that's affected our posture or the strength in one side in comparison to the other. Lunge right in, push the heel down to the ground, hold. So we're now coming to our longer holds, 2 to 3 repetitions each side. Do whatever feels good for you on the day. If you are noticing that some movements are irritating any injuries, then you can reduce the amount of time or the repetitions, or even skip them completely. It's better to do 50% than to do nothing. So just because we can't or we are not able to do, switch sides, just because we're unable to maybe do 1 or 2 exercises, or even 3 or 4 exercises, doesn't mean to say that we can't do a routine or we can't do a video. It's best just to do as much as we can, and that is, something is always better than nothing, and that will help us heal. Maybe you'll notice that the sensations release a little bit earlier, or you can take it a little bit deeper, or the sensation isn't quite as intense. side. Squeeze the kneecap, push the heel down to the ground. So we use our own muscles to lengthen our body. I'm pushing the upper part of my body into the wall as I push the heel away to use my own strength to lengthen. Each side, step the right foot back and the front knee. And for me, this leg is really relaxed now. You might notice the same has happened for you. You might not. Switch sides, last one. Everybody is different and every day will be different as well. It depends what's going on in our bodies, what else we've been doing. Depends on our health, our hydration. Last few breaths. Keep pushing the heel down into the ground, lunge deeper into the right knee. Come up to stand. We'll work on the hamstrings now. Hamstring stretch can be quite challenging if we're trying to avoid rounding into the spine. So we'll place the right foot onto the wall. Onto the wall or onto something. You may want to use some blocks, for example. You may want to pop the foot onto a block like so, or onto the wall, depending what is accessible for you. We'll bounce forwards, keep the spine long. To create elasticity, also creating glide in between the muscles and the fascia. So we release the sticky stuff that is in between the muscles and the fascia. Inhale, center. Exhale, hold. And this is why our hydration also affects our flexibility. If we're dehydrated, the sticky stuff in between the muscles and the fascia will get super sticky. So increased sugar, alcohol, caffeine, salt can often make us feel a lot tighter and make it a little bit more challenging, or the sensation a bit stronger when we are trying to work on flexibility. Back to center, switch sides, little bounces. This is also why sometimes when we feel ill, we feel really stiff and achy, because that sticky stuff in between the muscles and the fascia when we're ill thickens up and makes us feel really tight and stiff. Little bounces. It's really important to keep as hydrated as possible. Keep the spine nice and long. Again, if there's any movement that doesn't feel right, just reduce the range of movement, the repetitions, or skip them. Skip it, it's okay. Come to center. Inhale. Exhale. Maybe your foot's down on the block, that's okay. Push the heel into the wall as you send the sit bones up. Notice the sensations release. Switch sides. Inhale. Exhale. Switch sides. Inhale. Exhale. One more each side. Bring the right leg. Again, notice how different it might feel from the first time. Engage the quads. Notice when it releases, relaxes. Tell the body to relax. Last one. Inhale. Exhale. Use the breath, breathe into the belly and allow everything to expand. Notice any areas of tension, tell them to relax. Slowly come up to centre. And we'll finish off with a quad stretch. Open up into the front of the thigh and the hips. In our modern lives, we have often been overexposed to a sitting position, and this can make us tighten our quads and our hips, which can pull the pelvis forwards and create compression in the lumbar. It's really important to open up the front side of the body as well as the back line of the body. So you might want to use the wall to hold on to, or take hold of the foot and bring it towards the buttock. If this is super easy, you might wish to put the foot onto the wall and lean back towards the wall. Come onto the mirror so you can see a little bit clearer. So here I can squeeze my glutes, push my hips forwards, bring the shoulders to the wall. hold on to the foot. Maybe it goes to the bottom, maybe it doesn't go anywhere near the bottom. That's okay, it doesn't matter. So wherever you are at is exactly where you're supposed to be right now, and that's okay. Switch sides. This is quite yummy for those of us that are a little bit more mobile in the front side of our bodies, because I'm able to use my own weight to push against my foot, use my muscles to pull my knee back and really lengthen into the front side of my body. I'm also getting a stretch into the front of my foot and my shin. Notice everything relax and release with time. Switch sides, second set. Maybe this is easier to come into this time, maybe not. Maybe you're holding onto the wall and holding onto the foot, that's also okay. Switch sides. And again, one side might feel quite different to the other. Squeeze the buttocks, and that will help to open up the quad and the hip flexor, also the psoas. As we engage one side of the body, it helps to open up the other side, reciprocal inhibition. Tell everything to release. Last side, or last set, first side. If extension doesn't feel good for you and you're getting a little bit of compression here, tuck the pelvis under a little bit more. Keep the spine long in the lumbar. Last side. You can face the wall, hold onto the wall this way, squeeze the buttocks. Assist yourself however feels best for you. Pull the knee back, squeeze the buttock. Give everything a little bit of a shake now. Well done. Thank you very much for joining me today. That was flexibility training for lower back pain, disc herniations or bulging disc level 1. If that felt okay for you and you want to try level 2, please feel free to do so. Maybe even go on to 3 or 4. You can mix between all of them. Just work out what works for you. And like I say, this might change depending on what's going on in your body each day. Thank you very much for joining me. It was really wonderful to be able to guide you. Namaste.